Cymru for tabling this important debate today. As Aspa and Lung UK so ably put it, lung health is everybody's problem. Yet millions of people with lung condition still are not getting the help they need or deserve. My region of South Wales West sees some of the highest rates of respiratory deaths in the United Kingdom and Western Europe. It is therefore vital that we put in place an improvement plan for respiratory diseases and do all we can to tackle our horrendous record on respiratory deaths. As a good clinician will tell you, prevention is better than cure. One way we can prevent respiratory deaths is by tackling the scourge of mesothelioma. Mesothelioma is a type of cancer that develops from mesothelium, a thin layer of tissue that covers many of the internal organs. The most common area affected in is the lining of the lungs and chest wall. The vast majority cases are caused by exposure to asbestos. According to a recent inquiry by the House of Commons Work and Pension Select Committee, asbestos remains the biggest cause of work-related death in the UK. That is a shocking statistic when we consider that the use of asbestos has been banned for over 2 decades, but not surprising when we consider how prevalent the material is in many of our public buildings. The Work and Pension Committee warned that while extreme exposures might be a thing of the past, their risks were likely to escalate. The retrofitting of buildings to meet net zero requirements meant more material containing asbestos would be disturbed in the coming decades. While both the HSE and the UK government have said they believe it should be removed, the committee said neither had put forward a clear and comprehensive strategy for achieving this. This hidden killer still lurks in many of our public buildings in Wales. While deaths from asbestos-related lung cancers has declined in those working in heavy industry, the Work and Pension Select Committee were told that female primary school teachers now have one of the highest prevalence of mesothelioma as an occupational group. We can't continue to kick the can down the road. Covering up asbestos is not the answer. We must eradicate it from the fabric of the buildings. I would therefore urge the Welsh Government to introduce plans for the urgent removal of all asbestos in public buildings as part of their improvement plan for respiratory deaths and health. It's all well and good tackling air pollution on our streets, but we can no longer ignore the invisible killer in our classrooms and hospital wards. We need action. We need to eradicate asbestos. We need the Welsh Government to step up. Diolch yn fawr.